I'm Jamie Studts from the University of Colorado Cancer Center, and I appreciate the opportunity to speak with you today about the campaign to end lung cancer stigma. Before I begin, I'd like to express appreciation for support that I have received for some of my work on lung cancer stigma, but also to acknowledge that although I'll be talking about lung cancer stigma today extensively, that I do not pretend to be immune from its adverse effects, but instead try to monitor and identify and change when I experience lung cancer stigma in my own actions. We're at a terrific time where we're making amazing advancements across the entire lung cancer control spectrum, from risk reduction all the way through survivorship. We have tremendous advances in innovation that are improving outcomes. However, I believe that lung cancer stigma is the dark cloud that hovers above and impedes our ability to achieve optimal outcomes and delivery of these innovations to communities that need them very much. It hampers our ability to offer risk reduction programs, early detection, biomarker implementation, identifying and stratifying and treatments that are most appropriate for individuals, as well as slowing down and hampering our ability to deliver survivorship and palliative care interventions that improve quality of life and well-being across the continuum. With the National Lung Cancer Roundtable, we've identified lung cancer stigma and dubbed it a cognitive and affective and social experience, something that happens internally, but is also based on negative appraisal, devaluation, and distancing and discrimination by others. And in large part, this is due to an attributable relationship between tobacco and lung cancer, and it has an adverse impact on our ability to deliver optimal care. But frankly, it's a process of othering and differentiating, distinguishing and distancing between individuals who are affected by lung cancer and other parts of our community. And we want to work toward bridging that gap and reducing those negative impacts. We have substantial data showing the presence of stigma and bias, from early data from the Lung Cancer Project showing that lung cancer is associated with shame, stigma, and hopelessness. The GoTo Foundation's pioneering work on surveying survivors and showing that the vast majority report experiencing lung cancer stigma from multiple angles. More recently, we've seen data showing that lung cancer foundations receive substantially less support than individuals or foundations from addressing other malignancies. But we're starting to turn the corner. The Canadians have initiated the Wrong Question campaign to help individuals and society understand that the first thing we want to talk about in the lung cancer care area is empathy and support and compassion, not asking individuals whether they smoked or not. In the United States, we've initiated a project that has been dubbed initially the Lung Cancer Stigma Initiative within the National Lung Cancer Roundtable to eliminate lung cancer stigma as a barrier to achieving optimal lung cancer control and care. And that we believe that we can accomplish this goal through coordinated leadership, extensive strategic planning, advocacy, and collaboration. To develop this initiative and the strategic plan, we've gone through an extensive development process that has gone through initial formulation at the Stigma Summit that was held in February of 2020, all the way through the announcement and strategic planning that was put forth at the end of 2020. And now we've turned the corner. We're working toward implementation and changing our focus to addressing the challenge of lung cancer stigma that is being driven by our strategic framework. We recognize that through this pathway model that there are multiple causal factors that generate lung cancer stigma in our society, and that it has many consequences, from lowering our risk reduction efforts to lower funding for research. To eliminate this, we must eliminate the causal factors within society that generate and extend stigma, but also mitigate those consequences of those adverse impacts by offering better risk reduction strategies, informing these strategies by a lung cancer stigma reduction strategy. In many ways, eliminating these causal factors is the long game, is our long-term effort, and is going to take quite a bit of initiative and effort to change society. But while we do that, we must also mitigate those consequences to make sure our individuals have access to optimal lung cancer control and care. But it's only through the combination of both these eliminating efforts as well as these mitigating efforts can we achieve our outcomes. The strategic plan is large, diverse, and robust. We have several goals, measurable objectives, and strategies that have been developed. And this is available for additional information on the National Lung Cancer Roundtable website to really read and get into the details of the plan. But the overall purpose is to develop tools and strategies that multiple levels of organizations and individuals can use to address the causes and mitigate the effects of lung cancer stigma. We want these to be a combination of approaches working at multiple levels to ensure the greatest amount of impact. Across the way as we've developed these tools, we've infused them with the three key themes of urgency, empathy, and optimism as the real pathways in which to change our societal perspectives. But along that way, we also want to use supportive imagery and productive and engaging and empathic stories to help change our international perspectives on lung cancer. Our position is that lung cancer stigma adversely impacts all lung cancer care, and it must change. We also have this mission of employing interdisciplinary strategies to reduce the burden, to collaborate broadly with stakeholders to infuse the best ideas in order to achieve our goals. The core of what we're trying to do is work on messaging and media to ensure that these themes are infused across our campaigns. We want to integrate educational efforts in order to communicate with children about the complex relationship between tobacco and lung cancer in an empathic, supportive, kind manner, as opposed to something that is more fear-based and degrading. We also want to expand our survivorship efforts, and not just at the end of following diagnosis, but actually supporting better biomarker delivery and better delivery of lung cancer screening truly supports is one of the earlier efforts to support survivorship. By offering these in a anti-stigma informed manner, we hope to achieve better outcomes. And finally, we also hope to work on expanding the portfolio of research to actually infuse these and implement the innovations that we have more broadly to reduce disparities and harms. Across all of those, we want to work on tobacco and work on infusing a better understanding of the complex relationship between tobacco and lung cancer and help put it in its context in a supportive and empathic way. The four key themes involve reframing lung cancer from a societal perspective. It includes messaging and imagery. We want to improve survivorship, like I said, in delivering optimal care to mitigate the consequences. We want to enhance understanding and empathy through our educational efforts that are multi-layered and multi-tiered. And finally, as I mentioned before, amplify and expand the research portfolio that is available to achieve the new horizons in lung cancer care and control. And again, these will all be infused with our primary themes of urgency, empathy, and optimism. Fundamentally, we believe that lung cancer stigma is a pervasive and destructive aspect of culture and within healthcare. And frankly, patently, lung cancer stigma kills. We need more research to develop, evaluate, inform, and to transition to evidence-based interventions that address multiple levels of the lung cancer stigma challenge. We also need a host of advocacy and engaged interventions to promote empathy, compassion, and support for individuals at risk with lung cancer, as well as those individuals and families who have experienced a diagnosis and treatment. But fundamentally, also, lung cancer stigma can be addressed. We can reduce and work toward eliminating it with wisely applied data, compassion, and persistence. And finally, the biggest challenge is to how we can work together from organizations, institutions, individuals, working together to root out stigma from our systems and to provide a more compassionate and empathic environment for individuals at risk, as well as those individuals who have faced lung cancer. Thank you very much.